Okay, so I chose to do my drug PowerPoint presentation on ketamine. So what is ketamine? Ketamine is a dissociative anesthetic used on humans, and it can also be used on animals. It allows the user to feel detached from their environment, and it also relieves pain. Ketamine can be used for short-term sedation and anesthesia in medical settings, and it can also be used to treat depression. It's also an abused substance. It usually comes as a liquid, but can also be found in powder form. On the next slide, a little short video will play that will kind of look at how ketamine affects the brain and kind of how it can help treat depression.
Ketamine was initially developed as an anesthetic, but today it is also used as an analgesic and an antidepressant. It has been used as a recreational drug since the 1970s. After administration, ketamine is rapidly and extensively metabolized into an active metabolite called norketamine, which is thought to play an important role in ketamine's anesthetic and analgesic effects. Ketamine and norketamine both act at a receptor for the neurotransmitter glutamate, called the NMDA receptor. Glutamate is the primary excitatory neurotransmitter in the brain, and ketamine and norketamine act as antagonists at the NMDA receptor, which means that they block the receptor and inhibit activity there. Inhibition of NMDA receptors can substantially affect neurotransmission and is thought to be critical to the anesthetic and analgesic effects of ketamine. While most other antidepressants can take several weeks to achieve a therapeutic effect, ketamine can begin to improve depressive symptoms within hours and last for up to 2 weeks after a single administration. The mechanisms underlying ketamine's antidepressant action are not fully understood, but it's thought that it cannot be explained by NMDA antagonism alone. One hypothesis is that another glutamate receptor, known as an AMPA receptor, may play a key role. AMPA receptors may be stimulated indirectly by ketamine or directly by other ketamine metabolites such as hydroxynorketamine. Stimulation of AMPA receptors may lead to the activation of multiple signaling pathways and downstream effects such as new synapse formation in areas of the brain like the prefrontal cortex and hippocampus. These synaptic connections may bolster neural circuits involved with regulating stress and mood. Ketamine also acts on a number of other receptors, however, and there is still much more to learn about ketamine's antidepressant mechanism of action. Additionally, more evidence about the safety and effectiveness of ketamine needs to be collected for more physicians to support the use of ketamine as an antidepressant.
So category and classification of ketamine, it is a dissociative anesthetic and it's categorized as a hallucinogenic. The DEA schedule, it is classified as a Schedule 3 non-narcotic substance. So being scheduled as Schedule 3, usually Schedule 3 drugs are accepted for medical use, which ketamine is accepted to be used on humans and animals as like pain relief and as an I can't think of the word. Anesthetic. So it is accepted in medical use for anesthetic, sedative purposes, and then also to treat depression. It does have potential for abuse, hence why doing this presentation. Schedule 3 drugs also tend to be low in physical dependence, but high in psychological dependence. Also on this slide, I include ways that you can administer ketamine. So it can be injected in its liquid form, intravenously, or intramuscularly. In its powder form, it can be snorted, smoked, mixed into drinks, or pressed into tablets to be taken orally. Its liquid form can also be evaporated on hot plates, warming trays, or microwaves to produce crystals, and then those crystals can then be ground into powder to be snorted. It's also found in a nasal spray called Spravato, which is typically what's used when it's being used to treat depression. And I actually have a friend who's receiving ketamine treatments for his depression. And then also at my field internship, I've heard a couple people who are using it for their depression as well. And I have another short little video on the next slide, which kind of goes more into depth as to why ketamine can sometimes be more useful to treat depression versus like SSRIs.
This March, the FDA approved the first new chemical mechanism for fighting depression in decades. It's a nasal spray of ketamine, most commonly known for its use as a tranquilizer. How do drugs like these affect the brain, and what's new about this one? Let's start from the bottom. We think the activity of neurons in your brain produce your experiences and behaviors. While these cells are famously electrical, the connections between them are chemical. Where neurons connect with others, they let out little bursts of chemicals which can encourage or prevent the next neuron from becoming active. Any chemical that's used in this way is called a neurotransmitter. The most common neurotransmitters in the brain are glutamate and GABA, which are both present in around half of all neural connections. Glutamate is excitatory. It tends to cause neurons to fire more, and GABA is inhibitory. It tends to shut them off. You may also have heard of dopamine, serotonin, and norepinephrine, the stuff in EpiPens. These are some of the most common neurotransmitters known to affect behavior in the brain. We've actually discovered over 200 neurotransmitters, which are used by a whole zoo of different neuron types. Drugs that affect the brain are often found to imitate, bolster, or suppress natural neurotransmitters. A lot of what we know about the behavioral roles of neurotransmitters comes from seeing the effects of psychoactive drugs that interact with them. This is the case for depression as well. We still don't know for sure what depression is at the neural level because it presents in so many different ways for different people. Right now, like most psychological disorders, we're still working backwards from what we can observe behaviorally. For example, we know depression is marked by symptoms such as low mood, fatigue, mental fog, and suicidal thoughts. In the 1960s, scientists noticed that some drugs which changed serotonin levels in the brain had mood-related side effects. Those that lowered serotonin tended to cause depressive symptoms, while those that raised it tended to alleviate them. This led to the serotonin hypothesis, the idea that depression was related to a decrease in serotonin. SSRIs, or selective serotonin reuptake inhibitors, were developed to treat depression by increasing serotonin activity. Unfortunately, low serotonin isn't the whole story for depression. Many other neurotransmitters are also altered in patients with depression, and just raising serotonin levels alone isn't always enough. Around a third of patients with depression don't seem to respond to SSRIs. Enter ketamine. Ketamine interferes with glutamate signaling. Remember that glutamate is the major neurotransmitter that makes neurons more active, and it's in around half of all the connections in your brain. As you can imagine, interfering with it has some pretty wide-ranging effects. At high doses, ketamine effectively disconnects higher and lower brain areas, cutting people off from the outside world, making it impossible to see, hear, feel pain, or even produce memories. This is great for patients undergoing surgeries or other medical interventions, especially because it preserves heart and lung function, unlike most sedatives. Ketamine was approved for medical use in the US in 1970 and saw heavy application in surgeries following the Vietnam War. Low doses of ketamine were first found to affect depression in the late 90s. Antidepressant effects were seen within hours of taking the drug and could last for weeks. This was very different from SSRIs, which for some reason can take months to reach full effect and wear off quickly when you stop taking them. Research is still just beginning, but ketamine seems to do more than temporarily affect glutamate signaling. It somehow causes the brain to produce more chemicals that are basically neural fertilizers, helping neurons to grow new connections. When combined with other treatments like cognitive behavioral therapy, this could allow some patients to rapidly develop new pathways that help them to better regulate their emotions. Studies have shown that more than half of patients respond to ketamine, even when SSRIs don't work. Due to its immediate and lasting action, ketamine is poised to become an invaluable tool for treating depression. Of course, it's important to be cautious. This is a very new treatment. We've only observed patients for up to a year after receiving it. Ketamine can also cause hallucinations and has the potential for addiction and abuse. As a result, the FDA has only approved it for patients with moderate to severe depression who have not responded to at least 2 other medications. Despite these limitations, ketamine holds a lot of promise. It represents an entirely new way of treating depression by interacting with glutamate. As research continues, it may lead us to a whole new family of drugs and a deeper understanding of the neurochemistry of depression. Thanks for watching, and stay curious.
Okay, so like that video went over, I thought it was kind of important to go over how ketamine can be useful, while also being cautious of its addictive properties. So when being used like in addiction or not in moderation, the intoxication effects of ketamine, it can produce hallucinations. It distorts vision and hearing, such as dilated pupils and rapid eye movement. The user will usually feel disconnected and out of control. It increases heart rate and blood pressure. The user may also feel agitated and depressed, which ketamine can be used to treat depression, but taken not in a treatment setting, it can cause depression, which is kind of ironic. It can also cause cognitive difficulties like with memory, amnesia, and even unconsciousness. The user may become unresponsive to stimuli. It can also produce feelings of calmness and relaxation. It also can be used for pain relief, and it can also cause nausea. Health consequences of using or abusing ketamine: short term at low doses. The health consequences are similar to the intoxication effects. So, again, it can cause confusion, loss of motor coordination, dizziness, nausea, or vomiting. It increases blood pressure, heart rate, breathing, or body temperature. It causes visual or auditory hallucinations, and it also creates feelings of detachment from oneself, surroundings, and environment. Short term at higher doses, some health consequences of ketamine are respiratory depression and even death. Some more health consequences, but at the long term, it can cause a substance use disorder, so ketamine use disorder. It can also cause ketamine withdrawal syndrome, which includes symptoms of depression, excessive fatigue, and cravings. It can also cause the person to have or develop a physical dependence of the drug. Neurologically, it can change brain structure and function, causing memory impairments, and then also cognitive and emotional changes. I've also seen some articles saying people who use or abuse ketamine also have problems with their bladder. But I did not include that in this PowerPoint. So lastly, to go over some common street names of ketamine, there's kind of a lot of them. So there's cat tranquilizer, cat Valium, Jet K, Kit Kat, Purple, Special K, Special Le Coke, Super Acid, Super K, and Vitamin K. And then on the right side of the screen, I just put pictures of, Kit Kat candy and the Special K cereal. So it's not the tasty kinds. And then here's just my list of references. So I looked at the American Addiction Centers, the DEA, and the National Drug Intelligence Center. So ketamine can be used for some good, so like treating depression, when like SSRIs aren't working, but it can also be abused and cause some pretty significant health consequences. So yeah, that is my drug presentation on ketamine.